I am Mahmoud Hafez, Professor of Orthopedics at October 6 University, Cairo, Egypt. I'm going to talk about evidence-based medicine, and this is part 2. In part 1, we already discussed the definition, steps, and components of evidence-based medicine, and also level of evidence and quality of scientific papers. Now in part 2, we're going to continue to fulfill the objectives of these lectures, and then there is going to be a part 3 after that. When you publish papers in journals, you have to target the best journal. So a paper or any scientific article, whether a case report or a systematic review or meta-analysis, all these need to be published in the most relevant journals in order to get acceptance in these journals. As an advice, don't ever submit to predatory journals, and we're going to define what this means. High publication fees does not mean at all that this journal is good. When you target your journal, look for a journal of related to the specialty of your research. And don't be disappointed when you get rejection, because journals which has got high rejection rate, they are usually good journals. So what are the criteria of having a good journals? Good journals usually are credited, they are listed in the accredited journals, they are indexed, and for example, for medicine, they could be in Medline or in Scopus. They are not included in predatory journals list. They have high impact factor and usually they have high citation level. These journals are usually ranked with something called impact factor. This impact factor provides comparison between different journals in order to rank the journals, whether they are high ranking, the good ones, or they are at the bottom list. So it measures the frequency with which average article in a journal has been cited in a particular year. So what matters here is actually the number of citation of the paper in that journal, not the number of published papers. So it is actually a comparison between these two. So these figures are calculated by the Institute for Scientific Information, the ISI, and is published in a journal called Journals of Citation Index. The impact factor definition is the number of current citation from articles published in a scientific journal in a 2-year period divided by the total number of articles published in the same journal in the corresponding period. يعني نسبة وتناسب بين الcitation والnumber of published papers. So be careful of citation bias. So there are some negative aspects of this citation because of the bias. That could be self-citation, that authors are citing themselves, could be journals not included because of the language, different journals written in languages which is not English, and quality of work and other factors. There is another way of ranking called quartile ranking, which is from 1 to 4. And as a definition here, this is a category of scientific journals that shows their credibility, and the quartile ranking is based on from the highest to the lowest of the journals. So quartile 1 is the highest, is good quality, compared with Q4 or quartile 4. So here is examples for each Q. So Q1, 2, 3, or 4, and as we mentioned, Q1 is the highest. So this is provided by the top 25% of journals in the list. So here with the quartile, we are actually talking about like certain specialty. For example, if we take orthopedics as an example, so journal of bone and joint is a Q1 because it has the highest impact factor in that specialty. But this does not mean that it is higher than other journals. For example, journal of bone and joint impact factor could be 5, for example, while the Nature, British Medical Journal, or New England Journal of Medicine could be 40 or 50. Um, but both of them will be Q1 because for that particular specialty, which is orthopedics, the bone and joint journal has got the highest impact factor because in this specialty, the impact factor generally is lower as compared with other specialties. Quartile 2 is occupied by journals and the 25 to 50% group. For example, here Journal of Sports Medicine in the same specialty of orthopedics. Q3 is occupied by journals in the 50 to 75% group, like physical therapy reviews and foot and ankle surgery, or techniques in foot and ankle surgery. Q4 is occupied by journals in the 75 to 100% group, and these usually are journals with relatively much lower quality than mainstream journals of Q1, Q2. On the other hand, there are category of poor quality journals. It's called predatory journals, and it is listed in a predatory list. And their interests are not academic. These journals could be done by a businessman rather than a university or an institute or academic group. And they accept articles for publication along with authors' fees without performing any quality checks, like plagiarism or ethical approval or other things. And they publish quickly. So they attract authors who are not aware of what is meant to publish in a predatory journal. There are a huge number of predatory journals, and this number is increasing every day, unfortunately. So how we find them, or how we know that this journal is a predatory journal? Here are some characteristics. For example, they have false and misleading information, the lack of transparency, deviation from best editorial and publishing practices, and usually rely on aggressive marketing. They send emails inviting every author to submit their papers, and they say that they're going to publish it in a few days or so, and they give misleading information, like they say that their impact factor is high, and this is not correct. There is also lack of credibility. Here is another issue. Whenever you look at a paper, or when a paper is submitted to a journal, there is a check to make sure that the information is original and it is not copy and paste from others, and that's called plagiarism. So it's actually the copy and paste of paragraphs and from other papers, or textbooks, or others without quotation marks. It is a fabrication of data, can be detected using special software. So most of these journals, they have special software to detect the plagiarism. يعني بيصير حد ياخد work of other people. It is a reason for papers to be rejected by many accredited, or by all accredited journals. It is that a certain percentage of plagiarism could be accepted if it's quite small. It is a bad